Hi, Chris Gell here again with Pinnacle Training Consulting System. We're talking now in the section about shoulder injuries. One of the things that I see quite a bit, and you probably hear, is rotator cuff tears. So before we get into rotator cuff tears, I want to talk about how they occur. One, again, reasoning is degeneration. Degeneration means a wearing down. That can be of the supraspinatus. We talked earlier about someone works in the post office, the filing mail all the time, the same way, every time for how many years, and one day, boom, they have pain. Or something like a farmer lifting hay over one time puts stress on that supraspinatus tendon and it causes it to break down. Trauma, a fall, landing down. They're going to pull on that joint and pull on the tissue and tear the muscle. Impingement can cause dysfunction. So if someone doesn't have nice gliding of the humerus in that humeral joint and it butts head, you're going to get a compression of the humeral head on that tendon inside the AC joint. So those are the main causes of why rotator cuff tears occur. In your manual, you'll see there's small, medium, large. There's a small tear, which is usually 1 centimeter or less, medium tear 2 to 5, and large tears, which are 5 and greater. That is diagnosed by a doctor, usually an MRI. We as therapists can't tell people if they need surgery, and I think you shouldn't even do that either. Very good success rate with treating with tears who are small. They do really well. And again, we're talking 1 centimeter or smaller. Medium, large tears, depends on the person's age, depends on the person's lifestyle. If they smoke, that's going to affect the ability of healing, their diet if they're diabetic. So medium, large tears, depending on not do so great, large tears always usually need surgery. Medium may need a scope and not need a complete repair. Okay? Let's talk about exercises. One thing that you don't want to do with someone with a rotator cuff tear is shoulder press. Shoulder press like this is going to put a compressive load right on the axial skeleton, but right on that AC joint. So we're talking about right here, that right there is going to cause compression of the supraspinatus. The other thing you also want to do is pullovers. Pullovers where you're lying supine on a bench. Lying on a bench causes the humerus to glide backwards, and that's going to stress the anterior capsule and put pressure on the joint, which could impinge the AC joint as well as where the repair is. Third thing you don't want to do, you don't want to do upright rows. Upright rows work the upper traps. We've talked about this before. The upper traps are accessory muscles. You don't need to work upper traps. The upper traps are like a bowling ball. They hold our head. I mean, they are a support muscle that holds our head like a bowling ball on our neck. We don't need to strengthen the traps. We need to stretch the traps. So upright row creates that almost that impingement aspect at end of range. So there's no need to do that. The other thing I wouldn't do is barbell squats with someone who has a tear, because you're putting a load right on that joint and then you're compressing it through further end range exercise. Okay? And lastly, number 5 is lat pull downs. Lat pull down behind the head, not in front, behind the head is putting compression on the axial skeleton, and then biomechanically in front of the shoulder at end of range stresses the superior, which is in the front, in middle and inferior glenohumeral ligament. At end of range at 90 degrees, that stresses those ligaments and puts stress on the graft. So things you want to avoid doing. What can you do? Well, you definitely want to do things like rows. Rows I talk about are an excellent exercise for a lot of clients. We're talking about mid rows. Again, mid rows where you're pulling towards you. Extra rotation. Low trap pull downs at a 45-degree angle. Reverse flies are phenomenal. Anything for the lower back, doing back extension, glute work, is pivotal because you want to take pressure off from the chest. The thing also you can do is side raises. Side raises at 90 degrees is fine. It's not going to create any excessive load. Lightweight is ideal. And also you could do one-arm rows for the outer back, but you can hit the back here in the lats. Those are some exercises that I've got in the manual, and in the next section we'll talk about further shoulder dysfunction and some injuries and what you'll be doing with evidence-based training.